Welcome to another episode of the MedTech Dialogue. I am your host, Dr. Ashwini Kumar, and today we explore one of the most transformative shifts in modern healthcare, the rise of robotic and minimally invasive surgery in India. Joining us today with us is a surgeon, educator, innovator, and one of the most experienced voices in this field, Dr. Vivek Bindal. He is a graduate and postgraduate in general surgery from Maulana Azad Hospital, New Delhi, and FRCS Glasgow from UK. He is a senior director and head of department Institute of Minimal Access Pediatric and Robotic Surgery at Max Super Speciality Hospitals. He holds leadership position in several medical societies. To name a few, he is a president at Society for Surgery of the Alimentary Tract of India. He is a chairman at Clinical Robotic Surgery Association of India. He has performed thousands of robotic procedures and led training programs with institutes like CMC Vellore, AIIMS Rishikesh, SMS Jaipur, PSG Medical College Coimbatore for India's future surgeons and shaped how advanced surgical technology is being adopted across the country. Dr. Vivek, welcome to the MedTech Dialogue.
Thank you, Dr. Ashwini, for inviting me to your podcast. It is a pleasure to be here.
It's my pleasure. Pleasure is all mine, Dr. Vivek. So, Dr. Vivek, you had an outstanding career. You had an outstanding journey as a robotic surgeon. Would you like to share us some incidences during your education or maybe during MBBS that inspired you to pursue your professional career in surgery?
Yeah, I think when I joined MBBS, there was no such inkling to be a surgeon. And just went along with the flow and we rotated in different clinical departments as all students do. Uh, Went to surgery, went to medicine, went to pediatrics. But what I found during my internship was that, surgical patients, there was a patient who came almost on the verge of dying because of peptic ulcer perforation. We call it duodenal perforation. So that patient was pulseless, BP-less, in shock. We revived him by putting a lot of IV fluids, antibiotics, and within few hours he was wheeled into operation theater. His peritoneal cavity was lavaged after a laparotomy, and his perforation was closed. And next day his vitals were stable
Wow,
in the morning, and 3 days later he was going home. So
that's great.
that really told me something about surgery, the power of surgery, how it can heal the full disease, how it can resurrect a patient who is almost about to die. And then it so happened that there was a patient who came with liver abscess, and he had an amoebic liver abscess. And as you would know, that for a treatment for these involve aspiration,
Yes, sir.
ultrasound guided aspiration. So as an intern, I went with him and I aspirated almost 1.5 liters of pus from his liver over a period of half an hour after that ultrasound guided needle was put in. And he was in a very bad position that time. But next day, on the main rounds, when there was my head of unit, professor, senior residents, junior residents, interns, like they were like almost 40 doctors on that round. And that patient looked at me from his bed. He didn't look at the professor, didn't look at any resident, and he told me, "Oh, he saved my life,"
Wow.
and he was doing very well.
Yeah,
So
yeah, that's
that was it. I said, surgery is something which I want to do. This is how I want to change lives. I never saw that in any other department. I know other departments also heal patients, but this sort of magical transformation which I experienced in surgery, I did not experience in any other department.
thank you. Thank you for sharing such an inspiring story that helped you to, that actually shaped your journey to become a surgeon. Dr. Vivek, uh, you have, when did you start your career in surgery? On which year?
So I started my residency in surgery in 2006.
2006. Okay.
Yeah,
And when did you first came across robotic surgery?
2010.
2010. Okay. So you would have witnessed open surgery, laparoscopic surgery, and robotic surgery. Out of all these three, which one is the best for patient care?
Yeah, so I think that's a very broad question, but just to come to the previous one, when we were doing laparoscopy, and laparoscopic surgery is a wonderful operation. We do it all the time, even today. And when I got first opportunity to see robotic surgery in 2010, it was in Grosseto. It was in Italy, in a small city called Grosseto in Tuscany, where my mentor, Professor Giulinati, he started one of the best robotic programs in the world,
Wow.
and he had a training lab. So I went there, spent a week, saw what robots are for the first time, how they are, helping the surgeon, and that actually excited me quite a lot. And that was the time when I started looking onto it, and I made sure that I'm able to practice some robotic surgery, if not a lot. In that era where second generation robotic systems were there was only one company which was making it, and we were using the second generation S systems, which were obviously not as advanced as today's system, but still we could do a lot of stuff with that. And uh, I think, coming to the question about which one is better, open, laparoscopic, or robotic, we say that minimally invasive surgery is better for the patient. Open surgery is easy for the surgeon. So,
Okay.
open surgery is easy for the surgeon.
Yeah.
Minimally invasive surgery is easy for the patient. It's difficult for the surgeon. So, why it's difficult for surgeon? Because as you start doing laparoscopy, you are unable to see directly a 3D view. You look at a TV monitor, a 2D view, and your visual axis and your surgical axis become dissociated. So
Yes.
when you look at your hands and work, it's open surgery. So you're looking at your hands and working. But when you're looking at a monitor, but your hands are working down, so your optical axis and your working axes are different. So it is a learning curve. Then you're looking at a 2D vision. Then these are straight stick like instruments. If you have to move right, the tip of the instrument will move right if you move your hand into left direction. So it's counterintuitive movements,
Yeah.
and it is not like human wrist. So all these were limitations, and that's why it was always said that minimally invasive surgery is tough on surgeons, easy on patients.
Easy on patient.
But
Yeah.
robotic changed that. So the robotic technology brought in a digital interface to help surgeons make it easier for them. So the 2D vision was replaced by 3D
3D
vision.
vision. Yeah.
The standing posture was replaced by sitting posture. You could directly look into the console, and your hands would move as if you are looking in an open surgery. So your optical axis and your surgical axis are the same. Your tip of instruments are moving like your wrist and your fingers, so it is not straight stick like. So there were a lot of difficulties of laparoscopy which were overcome with robotics,
Robotics. Yeah.
and new things are coming up. A lot of AI mediation is coming, so there is a continuous advancement. But primarily these were the things that made robotic easier on the surgeon. And when something is easy on the surgeon, it becomes better for the patient, because if the workload of surgeon is less, if they are able to perform optimally well, I am of a very strong opinion that clinical outcomes become better.
Clinical. Yeah. Absolutely. So, would you name any surgery which only robotics can do and you cannot do it by laparoscopy? Have you encountered any such incidents?
Yeah, so I think in like the most expert surgeons' hands, all surgeries can be done laparoscopic.
Okay. Okay.
But in 99.9% of surgeons' hands, a lot of surgeries will not be able to done laparoscopy. So they would be either open or robotic.
Open
Like
or
we talk
robotic.
about radical prostatectomy. So radical prostatectomy is an operation where you have to go deep into the pelvis and you have to dissect the prostate and then reconstruct in a very narrow bony pelvis. Now, reconstruction in that narrow bony pelvis with straight stick like instruments is feasible, but it's very difficult, and the outcome is not going to be similar because the
Yeah.
reconstruction is not going to be as precise as you would have with robotics. So what that lead to? If you do it laparoscopic, the incontinence rates are higher. The you know, the pain is more, and the recovery is slow in most surgeons' hands. There would be few outlier surgeons who would be able to possibly replicate the same set of outcomes with laparoscopy as with robotics. But for the most surgeons under the two standard deviation curve, there would be a difference in the same set of hands when they use a robot or when they do it laparoscopy.
Okay.
We talk about abdominal wall reconstruction. When we do an ETEP procedure for Reeves Topa or when we do a component separation like transversus abdominis release, the precision of robotic system to go in between those abdominal wall layers is immense.
Yeah.
You can go in the potential space. So that space, there is no space actually. You are creating a space in between the rectus muscle and the protractor sheath. And that is where your robotic instruments give you that edge to be able to create that space, to be able to dissect it and then reconstruct it so well that the component separation rates are much lower when you do this robotic as opposed to laparoscopy, even in the most expert surgeons' hands.
Yeah.
So I think there is a strong clinical value in different surgical procedures
Yeah.
for robotic system.
For robotic system. So as you mentioned, in 2010 you went to Italy for this training program. I was going through few literatures and I found that in India, I think in 2006, first robotic instruments was installed at All India Institute of Medical Science AIMS. So during that time in 2010, at that point of time in India, there won't be many robotic surgical instruments, only in few institutes.
Yeah, I think they were like just 2 or 3 robots that time in India.
So how the robotic surgical instruments installment, I would say, means the way it got installed in various institute, how it has evolved in India, if you could just.
Yeah, so I think how the robotic surgery growth in India has been very slow to start with. So with any new technology, there is always, there are questions, there are apprehensions, and obviously there was a lot of cost involved. So initially the uptake was slow. There were just like less than 5 systems getting added every year. And then Vatikuti Foundation came in India in 2012,
Okay.
and it was led by Mr. Raj Vatikuti and Dr. Mahendra Bhandari. And Dr. Mahendra Bhandari was the vice chancellor of KGMC, a very renowned urologist, and they actually academically and scientifically started driving the robotic program by promoting surgical research, education, and training, and that started the actual robotic surgery journey of India.
Okay.
So many systems got installed in various corporate as well as government hospitals. So for 6 years they did a good job, and then the market leader Intuitive directly came in Indian market, and then we had the first competition to Intuitive from CMR, which made the Vercius surgical system, which got installed for the first time in 2019 in India.
Okay.
So the first human cases were done here in the world, and CMR rapidly grew because it looked at the general surgery market, which was not the focus area of Intuitive. And CMR, rapidly grew from 2019, 2021. It provided better economic models, better costing models, and we saw a lot of growth in number of robotic systems and the interest of surgeons. And then came SSI Mantra,
Yeah.
our own Indian robot made by Dr. Sudhir Srivastava, and that actually accelerated it further. because again, it was a disruptive technology with good costing and manufacturing in India. Uh, so that created more interest, because now the robotic systems actually started going to tier 2 and tier 3
Tier 3
cities,
cities, yeah.
and that accelerated the growth for Intuitive also, because the market leader globally still is Intuitive. So anyone who wishes to buy a robotic system would always look at Intuitive as an option too. So and then Medtronic also came in with its Hugo platform. Then we did the first human trial for Bond's Symphony system, which again, was showcased to a lot of Indian surgeons in conferences and cadaver workshops, and people were very excited. So I think all of this put together has accelerated the growth, especially after 2019-20. And in last 5 years, we have seen more than 500 robotic system installations across the country, all different companies put together, and a lot of other hospitals are in pipeline. So um, it's a geometric progression.
Geometric, yeah.
Yeah.
Yes. So the bonds clinical investigation. So would you like to say something about that on that study? How many robotic surgery clinical investigation you have been part of?
Right. So, see, we keep on doing a lot of research with robotic surgery systems and different procedures,
Yeah.
and we have published more than like 30 papers on robotic surgery,
Wow.
on bariatric surgeries, on abdominal wall reconstructions. And when Bonds came in, the founder of the company wanted to select a center for the first inward trial, which obviously was a big um, step for them, because they wanted to establish the system uh, it, as an effective system for human interventions. And he saw us, he met me, and it excited me as an opportunity, because it gave me a platform where I could interact with the founder and the engineering team and incorporate our changes and see how a new robot is developed. So we said yes, although it was a lot of, I would say, uh, work to get the approvals, as well as a lot of risk on your own professional credibility, because if anything goes wrong, it's an investigator initiated study,
Yeah.
the pilot study. So, but we said yes. We first looked at the system in lab for few months, and once we were convinced, we put in the application to CDSCO, and we got the approval for pilot study after few months of paperwork and a lot of questions. The animal study, of course, had been done earlier, and then we did 20 cases in that pilot study, which
Great.
all of them went
So
very well.
I would say that for India it's a proud moment because you're doing first in human study in robotics in India. So these are the things maybe these kind of studies elevate Indians and maybe SSI mantra. You see that now the Indian innovations coming up and they came with the product. So these studies and these innovations could be a factor where new startup companies they could plan to develop their own robotic surgical instruments. So,
Absolutely, yeah. I think these are very important landmarks if you talk about the Indian surgical, landscape and history. And with these sort of studies being done in our country, a lot of recognition comes up. Uh, Doing this safely with patient interest in mind, and ability to showcase the skill of Indian surgeons, and ability to showcase the research environment in India is something which is you know highlighted by ability to do these studies.
yeah,
And the I think our hospital, the DCGI regulator, everyone has been supportive.
yeah,
Although there are always questions like, why India has been chosen across the world for the first human study.
Mm.
But I think a lot of medical tourism is happening. A lot of patients are coming to us, choosing us over others, which are closer home, as the option for their medical care. We know that surgeons in India are very highly skilled, and there is a lot of patient population. So that's why a lot of experience is there. And with the amalgamation of right research tools, we can provide the best possible clinical research for the world. Also, with these Indian robotic systems, SSI mantra, the pioneering work of Dr. Sudhir Srivastav, it is a proud thing for
Yeah,
us, for all of
absolutely.
us, that he has developed this system. He has been a Da Vinci user himself as a cardiac surgeon, and now having put a lot of years of his life into this project and being able to develop an indigenous robotic system and commercially making it viable is something that we are proud of, and we sincerely wish him all the success, because that again is a landmark in the Indian surgical landscape.
Yeah. Thank you so much, Dr. Vivek, for bringing this. This lead to another thought in my mind that Indian 800 million populations are in village. So how government or public private, conglomeration or collaboration, how this robotic surgery can reach to at village level. So do you think in India it is doable, or if it is doable, what measures we should take?
Yeah, so I think providing access to remotest area and good quality care is a challenge, and with technology, that bridge can be that bridge can be made, so that the best quality care can reach the remotest parts of
Do
the
you think
country.
telesurgery could be one of the pathway that could
Yes,
be
absolutely.
explored to?
Absolutely, absolutely. So, you know, telesurgery was the reason why robotic system was developed in the first place by
Okay.
US Army.
Yeah,
So US Army wanted to treat soldiers in war fields
correct.
by surgeons in US, but it could never succeed in that era. This was, before 2000, and that's when it gave the technology to civilians to utilize. But now we are, many decades ahead. The networking is much better, and now we are seeing successful telesurgery being done in between Indian cities, and in between continents, and in between countries, without much lag, which used to be the biggest problem with telesurgery. And good surgical teams on both the sides. So, in case of a problem, there is a surgical team on the other side to take care. So I recently was a part of the international telesurgery guidelines for robotics, which was a meeting which was held in Los Angeles, and our Clinical Robotic Surgery Association is coming up with a very good guideline draft on how to make it safe. So it is now present. It is, we used to think it's always the future, but now it's already there, and we are able to connect district headquarters. We are able to connect subdivision level hospitals to metro cities.
Wow.
So a surgeon who had to travel, like, I traveled to so many cities to proctor people to get the robotic surgery program started. So I traveled to CNC Vellore, I traveled to PhD Medical College Coimbatore, PGI Chandigarh, AIMS Rishikesh, and CK Birla Jaipur. So like multiple hospitals across the country, but you have to go there, train. Now you can teleproctor. Now
Yeah.
you don't have to travel. So
Yes, yes.
something which would take you 1.5, 2 days would take you 2 hours,
True.
because you can just sit on the console at your place and you can teleproctor. You can provide your surgical expertise in the remote locations by doing these surgeries, and that definitely is one of the ways to increase the best quality care in the remotest of
Yeah,
places.
primary health center.
Although the cost and
Hmm.
the technology as well as availability of qualified healthcare professionals on the other side, on the remote side, is something which are roadblocks as of now.
Yes.
But uh, going ahead, I'm sure there would be ways to find tools to overcome these roadblocks, and we are going to see this care going via telesurgery to the remotest of places.
Yeah. Now I'm going back again to 2010. What I have learned that we don't have any courses on surgical robotic procedure in our MCH, or I think in general surgery also.
Right.
So I think, and you have been one of the veteran in robotic surgery who has taken this initiative. You have trained so many surgeons. So if you could enlighten on those things, that how
Yeah.
soon we are going to have this inside curriculum, or it is a distant objective, or means what Indian government is doing, what as at private institutes are doing to
Yeah, I
overcome this.
think so. When I got trained in 2010, we had to just do everything ourselves and try to find a place. So, where initial training just means some exposure,
Yeah.
and then when I started doing surgery, every few months I had to go to US for 3 days, observe some cases, come back, and then do them.
Oh, such a
Then again after few months, go for 3 days. I used to leave on a Wednesday, reach there Thursday morning, used to observe Thursday, Friday,
my
leave
God.
back on Saturday, come here and operate on Monday. So we used to do that, and there were no mentorship programs, no proctorship programs. There was no trained surgeon out here. I then did my 1 year fellowship from US, and then I got my professors also to come to India all over and help me in surgery. So there was a lot of difficulty and lot of passion, energy, time required for doing all this, and that's why uh, I think it's very important to have a professional society that helps the younger surgeons train in an effective way, as well as our medical bodies. So we made the first Robotic Surgery Society of India in 2019, which was the India chapter of Clinical Robotic Surgery
Wow,
Association,
great.
and that helped train a lot of surgeons in the country by doing
Great
workshops.
initiative, Dr. Vivek. Yeah.
And then we also started Association of Robotic Innovative Surgeons, and we
Mm-hmm.
started a fellowship program of ARIS, and we have trained more than 200 surgeons till now in that
Wow.
fellowship program. And this year more than 100 surgeons are enrolling in that fellowship program. So we have cadaver training programs, we have dry labs, we have simulations, we have online lectures, we have case observations in multiple centers of excellence that we certify. We have thesis, we have our collaboration with Royal College of Surgeons of Edinburgh, we have our university affiliation with Sri Ramachandra University in Chennai. So, this is a 1 year fellowship, and people at the end, they have now become proctors themselves. So they are now proctoring others. So it's a chain. You have to kickstart the chain, and that chain, that domino effect has been started. I'm happy that we have been able to go there. We also started the first abdominal wall reconstruction course in robotic surgery in Asia. So
Wow.
the only such courses were happening in Europe or US. Nowhere in Asia there was this TR 400 course of robotic cadaver abdominal wall was happening, which we started at Ramaiah Medical College in Bengaluru in 2023. So last 2.5 years, more than 40 surgeons have been trained, and they are like now master trainers for others. So I think as I said, Indian surgeons are very skilled, and once they are told about a technology, they just need some hand holding initially, and then they
Yeah.
become masters within a very small period of time, and then they are able to teach so many others. So it's a it's a wonderful, exciting
Yeah.
time to
So do
be
you
in.
think that there will be need of more training institutes in future, or
Yes,
maybe?
absolutely. We in fact went to the government and we gave proposal from our society
Mm,
to the Director General Health Services to inculcate robotic surgery in the curriculum from National Medical Commission
okay.
in the surgical residency programs. Right now, public institutions have limited access to robotic systems. Only a few public institutions have robots. Institutions like AIMS, JIPMER, and PGI, they
PG.
have actually created some curricula around robotic surgery training. We published from our society also the current training and credentialing needs for robotic surgery in India, and I think work is being done there. So what we recommend as a society is that robotic surgery should be a part of all organ specific trainings courses. So like if someone is doing an MCH in GI surgery, robotic surgery should be a part of that training.
Yeah.
And if someone is doing MCH in urology, they should learn robotic in their space. If someone is doing MCH in gynae oncology, they should learn robotic in their space. So it is organ specific robotic surgery training, and I think we are going there, but it is going to take
It is going
many
to,
years.
maybe in the same curriculum in MCH, the particular
Yes.
organ, it could be one of the part,
Yes,
the
so it
robotic
has to be a part of the curriculum,
curriculum.
because if you are learning urology, you should be able to do open surgery, you should be able to do laparoscopy, you should be able to do robotic surgery.
Yeah, true.
So, and similar for GI surgery. So, I think, but for that, the teachers need to be trained first. So, the institutions need to have robotic systems. So, we run our own fellowship programs in our department, and we get 3 fellows every year who spend a year, and at the end, they are proficient robotic surgeons. So I think multiple initiatives are being taken, but there is a need of something from the government in a more formal way, which would be able to bridge this gap.
Business. Yeah. Coming to the advancements in robotic surgery, so I was going through few literatures where single port minimal invasive surgery is now taking another shape. So, what is your thought on that?
Yeah, I think single port robotic surgery is something which is very exciting, and we used to use the single site surgery by Intuitive earlier, and now there is a SP system, single port system, which gives a lot of cosmetic benefit to patients. So
Only one
there's one
incision.
one incision which is hidden
Yeah.
in the belly button, and you can do your gallbladder, hernias, appendix, all that, fundoplication. So many surgeries are being done. Even cancer surgeries are being done, partial nephrectomies, radical prostatectomies with that system. Other companies are also coming up. So like Bonds again has made a platform which has both single port and multi port in the same system, and now there are instruments which are 5 millimeter and 3 millimeter also. So most of the robotic instruments are 8 millimeter now. Very small, very fine 5 millimeter and 3 millimeter endoristed instruments are coming up. So I think all of these are going to provide better
Better
cosmesis
cost. Yeah.
and possibly less pain in certain procedures. Uh, and I think if you are able to do the same surgery with the same precision and give good clinical outcome without any sort of uh, scars, why not?
Yeah, and a lot of talk about AI. So, how do you see AI helping robotic surgical instruments?
Yeah, I think what we say that there's a lot of noise, as you said, a lot of noise around artificial
Yes,
intelligence.
absolutely.
Now we need to see how much of that noise translates into value,
Value, yeah.
and that value proposition of machine learning and artificial intelligence is huge, in my opinion. Uh, we are going to see autonomous robotic systems doing certain steps. So it will be like autopilot,
Autopilot, yeah.
and the pilots will always be there, but you can switch to autopilot, and a particular part of your surgery will be done by the robotic
So
system.
maybe if the surgical field is similar in a lot of surgery, it's
Yeah,
almost similar. Then you think that those
right.
surgery
So
could be performed by the AI alone in future. Is it
yes,
so?
yes. So if you have sitten in these, if you have sit in these driverless cars, so you
Yeah.
drive in, in Waymo. I had a ride in Los Angeles in a Jaguar, and there was no
Sir,
driver, and
I sat in one of the car which was
yeah,
driverless when I
right,
was in Oregon,
right,
Weverton.
yeah,
Though the driver was there,
yeah.
but he didn't
He
touch.
didn't do anything.
Yeah, he didn't do anything.
So in my case, even the
He
driver was
just fed
not
the
there.
data that we have to go from this destination to another destination, and the car took. That's,
So in my case, there was no driver. So we were
yeah.
just sitting there. There was no driver, and the car was
Oh,
going here
okay.
and there, and it
Mm.
was a very busy street of LA, and we were like roaming around for half an hour. So if that can be done, a lot of
A
surgeries
lot
can
of
be
surgery
done.
can be done, yes.
Now, many companies, including Intuitive, have developed machine learning protocols which have enabled the robots to do intestinal anastomosis by themselves. So you could just put two bowel segments together
Mm-hmm.
and say, okay, suture them. Press the auto suture button and it is going to suture it. And if you feel that robot is not doing well, you can overtake. You can
Oh,
just
okay.
you can always override it. But this is something which is present, not future. So uh, machine learning is going to change the way surgery is being practiced right now. It is going to elevate the standards of surgery. It has to be done in a safe way. That is important.
Yeah.
And I think it is going to enable surgeons to do surgery more efficiently, although cost will definitely
Will
be a
be.
deterrent initially.
Yeah. So, Dr. Vivek, now economics of, let us discuss the economics of surgical robots. So, how costly it is compared to open surgery or laparoscopic surgery? You can just give us the percentage. I don't want to know actual value, but
Yeah, see, I think it depends on procedure to procedure, but it significantly adds cost if you go robotic in a procedure. And, in some cases, it would jack up the cost by 30, 40%, 50%. Now, but, as patients, they are entitled to the best possible care. And that is what we believe as a surgeon and as a surgical society. So we have been uh, you know trying to tell the regulators and trying to tell the payers the value of robotic surgery. And I am happy to share that we have been successful in uh, getting robotic surgery coverage under Mediclaim policies in
wow, that's great.
2020.
Okay.
So as a society, we told them, and IRDA, the Insurance Regulatory Development Authority, came out with a circular in 2019 which mentioned that all robotic surgery should be covered in Mediclaim policies 2020 October onwards. And then again in 2024, IRDA has come up with another circular which mandates the coverage for robotic surgery. So last few years we have seen a lot of uptake of robotic surgery by patients because their policies are covering it. Also, with this level of evidence that has been published, and we have been able to tell the government, so some government schemes also have started covering robotic. So the CGHS scheme covers robotic surgery for cancers now. The Rajasthan government scheme has now initiated the robotic surgery coverage for almost all the diseases. That
Mm-hmm.
is the first state in the country to do so. And there are other states which are following this. So I think more and more people are getting access to robotic surgery because of the insurers or the payers are paying for it. And that is really adding to a lot of value, because any instrument is worthless if you are unable to uh, you know uh, give any sort of benefit to the final end user.
Yeah. That's a wonderful news. So I was just reading one article, and in last year in 2024 there was 60,000 robotic surgery performed in India.
Right.
So what do you say? It's a good number, great number, or
I think
it's
it's
a
a pretty good number
hmm,
for robotic surgical procedures. We
okay?
used to be like 2,000 procedures, 3,000 procedures in a year. Now, more than 50,000 procedures is a pretty good number, and most of these are advanced procedures. We are doing a lot of complex reconstructions and a lot of complex procedures which were done open by a robotic surgical method. And I think we are at the inflection point where it is going to rise way more than what we can expect as
Yeah.
of now.
So that leads to another question, that for Indian innovators, for Indian startups, and also for global exporter company, I think India is going to be a good opportunity in future for
India
robotics.
is definitely so. Almost all robotic surgery companies in the world are looking at India as one of the biggest markets for them,
Yeah.
and they want to come to India. They want to invest here. They want to build not just their market but also manufacturing facilities in this country. Uh, and this trend I have been very closely seeing, because most of these robotic companies end up with meeting us and getting our opinion. And we have seen in last 1 year 3 new robotic systems getting CDSU approval and commercial approvals in India. Um Even the biggest companies are thinking of starting their own manufacturing in India, like iPhones. So I think there is a lot of movement in that direction.
Yeah, and we at CliniExpert is one of the preferred partner for these companies as well, because we have both the arms here in our company. We have a regulatory arm where we seek approval from CDSCO, and we do have a CliniExpert research services where we are doing a lot of trials in medtech space. So we would love to support Indian companies as well as global company if they want to launch their products in India.
I think yeah, that is something which all these companies require a lot, because that is the real area where they need expertise, and they need someone to bridge that gap, because they are not aware about the regulatory environment here. They are unable to do the trials or set up the manufacturing. But I think yeah, you you will have a lot of extra work now at your hands, I'm sure.
Sure, Doctor. We would love to help industry in this regard. Thank you so much, Dr. Vivek, to coming to my podcast, and your insight and vision is going to help many viewers who are going to see our dialogue, MedTech dialogue. And I would request viewers to go through YouTube channels of CliniExperts where these podcasts would be published. You can gain a lot of insights from today's discussion, which I had with Dr. Vivek. Thank you so much. Thank you, Dr. Vivek.
Thank you, Dr. Ashwini, and thank you, CliniExperts, for having me here at this wonderful podcast. It was a very enjoyable discussion, and you brought out a lot of points. And as I'm thinking, I think I also learned while I was speaking, because many times you don't get the time to think over. And once someone like
That's a
you,
very kind gesture of yours.
no, absolutely. I think when you ask something, so then
Mm.
you go back in your mind and fish out things which otherwise you were not at all thinking.
Yeah.
So thanks for having me, and
Thank
we
you,
look
sir.
forward to interacting.
Thank you once again.
Yeah.